more MRI stuff, and just kind of a continuation of one the other day. Can't predict symptoms from an MRI, and just have a couple of more recent cases, people that both were in accidents in April, and we had some MRIs done on both of them. And it's just interesting when you're always looking through this stuff, and you always have to remember, correlating with exam findings, patient history, and how the patient is feeling through treatment. Because we take this one person who they're an older person, they're born in 1960, and when they came in there, they're complaining of some kind of moderate neck and back pain, which is pretty typical in any accident situation. And get the MRIs back, and we've got disc bulges, herniations, foraminal stenosis, osteoarthritis, everything you can imagine at 1, 2, 3, four of the discs in the cervical spine, to varying degrees, and we have all the pathologies you can think of on an MRI report at every level of the lumbar spine. So you look at this and you would think, man, given the information I have from this report, all these disc bulges, disc herniations, foraminal stenosis, end plate osteophytes, every anterolisthesis, all the stuff that you're seeing on this MRI report, you would think, man, this guy must be like disabled. But when you talk with the patient a month into care, and they're almost pain-free, and they were reporting they didn't have really any symptoms beyond just kind of minor neck and back stiffnesses here and there with work prior to the accident. And all this stuff was all there before the accident, because this person's older, and given the bony changes, hello everyone, given the bony changes that are also around the disc injuries, that those have been there for a while. So you just always have to keep in mind, when you're reading this off the person, you also have to keep in mind that you don't put them in a situation where they start to regress, because now they're worried about all these things that showed up on the MRI. Because the report is just all the report is just information. It's just what the radiologist sees. That's all it is. It doesn't predict anything. They always end their reports with must be correlated clinically, or something to that effect. So the other part of this is the other person that we saw more recently, but their accident was around the same time, and they're much younger. They're born in 2001, and the only thing we saw an MRI with them was a 1 millimeter disc bulge at C6, C7, and this person is having an incredible pain situation, going from the neck and having symptoms into the left hand. And even with conservative treatment so far, the person's still reporting not a whole lot of improvement. And so you always have to keep in mind, okay, for one reason or another, this much younger patient with one recorded injury to a disc on the report, compared to this older individual who has disc injuries at every single level imaginable, to much greater degrees if you're just reading. That person with all this stuff reported is pretty much symptom free in 30 days after their accident, whereas the person with one disc injury that's objectively small is still having significant pain 30 days into treatment. So you always have to keep in mind, what are the expectations of the person? How do they interpret what you're telling them? What's their history with pain and other injuries and things. Perhaps the younger person's never really had anything happen to them before, so they don't have a lot of reference for how they're supposed to feel or how they can feel. And yeah, just it always just makes things you know a little more complicated, we'll say, as the clinician when you are working with various kinds of people from various backgrounds with various injury histories, various occupations, various degrees of we'll call them pathologies because that's the word you would use on their reports. But you don't always have the same path to improvement. They don't always end up with the same outcomes. And things are not always, one-to-one damage to symptoms, and people just get better at different rates. And some people, even with very low levels of what you would consider small levels of damage, can be some of the most difficult to work with. So you're always you have to kind of find the best way to approach that person, build a good relationship, make sure that they're trusting that you're helping them on the right path, and hopefully the outcome comes along with that and you get the desired result. So that's all for today, and check my YouTube channel for more, and see you next time.